Ajolode, Ogodo, Inanjole, Ajoloko, Inanjole, Ajoloko, Inanjole, Ajolode, Ogodo, Inanjole, Ajoloko, Inanjole, Ajoloko, Inanjole, Ajolode, Ogodo, Inanjole, Ajoloko.
Diabetes is no doubt one of the world-killing disease. Diabetes is a group of metabolic disorders, characterized by a high blood sugar level over a prolonged period of time. Symptoms often include frequent urination, increased thirst, and increased appetite. If left untreated, diabetes can cause many health complications. Acute complications can include diabetic ketoacidosis, hyperosmolar hyperglycemic state, or death. Serious long-term complications include cardiovascular disease, stroke, chronic kidney disease, foot ulcers, damage to the optic nerves, damage to the eyes, and cognitive impairment. As of 2019, an estimated 4.2 million people had diabetes worldwide, with 8.8% of the adult population. In 2019, diabetes resulted in approximately 4.2 million deaths. It is the seventh leading cause of death globally. The history of diabetes was narrated by Professor Pierre Lefebvre to WDC-TV.
The whole thing started in the 20th century. Insulin has been discovered in 1921, then it has been isolated, it has been purified, it has been crystallized, then the place of origin of the insulin has been described to be in the islets of Langerhans. There have been numerous studies to know how insulin is secreted from the pancreas, and then it's only 40 years ago that people started to really understand how insulin is working. So for all those who have to take care of people with diabetes and prescribing insulin shots 3, 4, 5 times a day, it's good that they know exactly what has been the history of this life-saving drug or substance that is insulin. So we had a unique opportunity to have people who have known how to treat diabetes 50 years ago, and what have been the improvement, what have been all the changes in the insulin, the way it has to be given, the way it has to be injected. And so that's interesting.
The Africa people are no doubt victims of diabetes. This was buttressed by Professor Jean-Claude Mbanya of the University of Yaoundé,
My name is Jean-Claude Mbanya. I'm Professor of Medicine and Endocrinology at the Faculty of Medicine and Biomedical Sciences of the University of Yaoundé, Cameroon. I've been dealing with diabetes since 1990, so you understand that I've been in the diabetes field for a long time. I have seen people dying from type 1 and type 2 diabetes because of lack of access to medication, to medical treatment, to care. Especially type 2 diabetes has emerged as the most important cause of morbidity and mortality. This is a region where in the early 60s, they said diabetes was rare. But nowadays, diabetes is so common that you see it everywhere on the continent. In fact, if you look at the IDF Diabetes Atlas of 2019, you see that the projection of sub-Saharan Africa is exponential if you think that diabetes would increase from 19 million to about 47 million from 2019 to 2045, which is an increase of 143%. Which is a region with the greatest increase in the world.
The increasing rate of diabetes in Africa formed the reason why the NBM of Africa, Delta Zone, to embark on a medical outreach to the Refinery Road market. This market accommodated many women who were novice of the diabetes status. This medical outreach by the NBM of Africa, Delta Zone, afforded the market women to know their status, as well receive blood sugar test and blood pressure test. Most discovered patients of diabetes were recommended to hospitals for immediate treatment. This was a memorable event for the market women, as they prayed and appreciated the NBM of Africa for their kind gesture.